The city hospital rested in a deceptive calm, as if the walls themselves were trying to fall asleep despite the faint hum of machines behind closed doors. The corridors stretched endlessly under the pale glare of fluorescent lamps, each flicker adding to the sense of unease that clung to the building. Outside, the autumn rain lashed against the windows in restless bursts, drumming an uneven rhythm that seeped into the sterile silence within. The hour was late, yet the air felt heavy, expectant, as though the night held secrets waiting to unfold. Professor Ivan Gorchakov entered the hospital with the confidence of a man who had spent decades commanding life and death. His reputation preceded him wherever he went. The surgeon who defied impossible odds, the mentor whose lectures filled halls with awe, the name that appeared in international journals and was whispered with respect among colleagues. He wore his authority like a second skin, as natural to him as breathing. Night duties were no longer a challenge, only a repetition of familiar rituals, a stage where his mastery rarely faltered. But as he crossed the dimly lit reception area, something unsettled stirred beneath the surface of routine. The quiet was deceptive, masking the anticipation of an imminent storm. Nurses moved with unusual urgency, their hurried steps echoing against the tiled floor, while the faint smell of antiseptic seemed sharper than usual, mingled with the distant trace of gasoline brought in from wet clothing. The rain outside mirrored the turmoil that had just entered the building. A man had been brought in by ambulance, a driver pulled from the wreckage of a late-night collision. His body bore the marks of violence, blood-soaked bandages wrapped hastily around his torso, abrasions along his arms, a face pale from shock and blood loss. Monitors connected to him screamed a fractured song of instability. His pulse leapt and faltered without rhythm, his blood pressure swung between extremes, and his heart seemed caught in a struggle it could not win. For Gorchakov, cases like these were familiar, yet something about this man resisted the ordinary patterns he had mastered. Standing over the gurney, the professor felt a subtle dissonance. The patient's condition was critical, yet not typical, as though the body itself defied prediction. What should have followed a clear trajectory of decline or stabilization instead twisted into erratic bursts of collapse and recovery. It was as if the man's heart was both determined to stop and unwilling to let go, holding on by threads invisible to medicine. The storm outside raged on, pounding against the glass, while within the hospital, a different storm quietly gathered. Gorchakov adjusted his gloves, ready to impose order on chaos as he always did. Yet for the first time in many years, he felt a faint echo of doubt slip into the certainty that defined him. The night, once expected to be routine, had already begun to turn into something else, an ordeal that would not yield to skill or experience. The first hours of the struggle unfolded with a rhythm that Professor Gorchakov knew by heart. His hands moved with mechanical precision, each gesture flowing into the next like a sequence rehearsed countless times. The team around him responded instantly, anticipating his needs, adjusting instruments, passing tools, stabilizing monitors. The operating room became a stage of discipline and focus, a choreography of life-saving effort that had carried him through decades of crises. Yet beneath the surface of routine, something unspoken pressed against him, a quiet unease that refused to fade. The patient's injuries were severe. Broken ribs threatened the lungs, lacerations traced deep into tissue, and the shadow of internal bleeding cast itself across every decision. The heart, irregular and fragile, demanded constant attention, forcing Gorchakov to adapt with each unstable beat. Normally, his confidence would override the chaos, his instincts guiding him where data fell short. But tonight, as the monitors screamed their warnings, a subtle crack appeared in the fortress of certainty he had built over years of mastery. Every adjustment of medication, Every calculated incision seemed to falter against the unpredictability of the body before him. Blood pressure climbed sharply, then plummeted without reason. Oxygen saturation veered wildly, ignoring the mechanical rhythm of ventilation. The heart's contractions, instead of stabilizing under pharmacological control, seemed to resist, as if governed by some hidden will that defied medicine's grasp. Each anomaly widened the gap between what he knew and what he faced. The laboratory reports arrived one after another, but instead of clarity, they brought only confusion. Hemoglobin levels shifted beyond explanation. Clotting factors appeared unstable, and electrolytes carried patterns that contradicted the trauma's expected progression. Gorchakov studied the numbers in disbelief, searching for coherence, but the more he read, the more it seemed as though the patient's body was operating by rules unfamiliar to him. A silence grew inside his mind, a stillness different from his usual calm. It was not confidence but doubt, a creeping awareness that his knowledge might be inadequate here. For the first time in years, he felt himself standing not as the master of the situation, but as its witness, unable to shape its direction. The instruments at his disposal felt suddenly blunt, and the certainty that had defined his reputation wavered. The patient's chest rose and fell under the artificial rhythm of the ventilator, but the rise and fall carried an unnatural tension, a fragile balance that threatened to collapse at any moment. Gorchakov watched the man's body tremble with each failing beat, and in that trembling, he sensed something more than trauma, something intangible yet undeniable. It was as if the body itself resisted survival, rejecting every attempt to preserve it. In that moment, Gorchakov recognized a shadow he had long kept at bay. Doubt, subtle and insistent, whispered at the edges of his thoughts. It told him that his skill might not be enough, that his name, his prestige, his decades of experience could not guarantee victory here. The shadow grew heavier with every erratic signal on the monitors, every unexplainable result on the charts. By the time the second hour passed, Gorchakov stood not only against the failing body of his patient, but against the unfamiliar weight pressing upon his own chest. For the first time in his long career, the surgeon who had conquered countless impossible cases felt the fragile tremor of uncertainty. The operation stretched into endless hours, measured not by the clock, but by the rhythm of alarms, the flow of blood, and the unyielding resistance of a body determined to fail. Under the harsh brightness of surgical lamps, every surface gleamed with sterile precision, yet the air carried the heavy scent of blood and antiseptic that no ventilation could erase. Professor Gorchakov's hands moved flawlessly, each incision and suture executed with the calm assurance of decades of practice. Yet perfection itself seemed powerless here, as though the very laws of biology had turned against him. The bleeding would yield to pressure, to cauterization, to every refined technique in his arsenal, only to surge back with cruel defiance. He stitched torn vessels with meticulous care, watched the flow diminish, only to see it burst forth again moments later, mocking his efforts. The heart responded to shocks and medications for brief intervals, its rhythm returning with a semblance of stability, but then collapsing into erratic chaos as if rebelling against every intervention. Around the table, younger surgeons and nurses moved with discipline, their eyes fixed on him as though his very presence was enough to bend fate. They waited for the moment they had seen so many times before, when the impossible would yield under his skill, when the patient destined for death would be pulled back into life. Their faith in him was palpable, almost suffocating, as if belief alone could transform failure into triumph. But as the minutes turned into hours, no miracle came. The monitors told a relentless story of decline, each line jagged with instability. each number slipping further away from viability. Gorchakov heard the whispers of machines more clearly than the whispers of hope in the room. The weight of expectation pressed harder with each passing moment, and he felt it not only in the eyes of his colleagues, but in the trembling of his own chest, where certainty had begun to fracture. He tried every strategy he had ever mastered, every trick that experience had etched into his memory. He altered rhythms of compression, shifted dosages with precision, adjusted sutures in places where others would have surrendered. Still, the body before him resisted with uncanny resilience, as though life itself had decided to retreat and no human hand could reverse its path. The silence between the beeping monitors grew unbearable, punctuated only by the shallow breaths forced by machines. The atmosphere in the operating room thickened with a quiet dread that no one dared to voice. For all their training, for all their discipline, the team knew they were standing on the edge of inevitability, and only Gorchakov's reputation held them from despair. At last, the surgeon felt the truth sink into his bones. Every movement, though flawless, served only to prolong suffering, to delay what could no longer be prevented. The recognition cut deeper than any scalpel he had ever held. His mastery, celebrated and revered, had reached its limit. For the first time in years, he stood not as the savior of lives, but as a witness to their quiet departure, a man forced to acknowledge the boundaries of his art. The operation ended with only a fragile semblance of stability, a victory so temporary that it felt more like postponement than triumph. Machines hummed in unison, maintaining a rhythm that no longer came from strength, but from delicate interventions and fragile hope. For the first time since the ordeal began, Professor Gorchakov allowed himself to step back and truly see the man who lay before him, no longer just a body on the edge of collapse, but a person with fragments of a life hidden behind the bruises and scars. The man's face was pale, framed by the harsh shadows of the surgical lamps, yet there was something quietly human in the stillness. His hands, roughened and torn by years of labor, told a story of unrelenting work. In the pocket of his blood-stained clothing, the nurses had found a worn photograph of a small girl, edges curled with time, her innocent smile frozen in a moment long past. That image, more than any monitor or chart, struck Gorchakov with a weight heavier than any scalpel could cut. For decades, he had defined himself through mastery, through the certainty that medicine bent to his skill. But now, all he could feel was the bitter awareness of limits. This man was not an anonymous patient reduced to numbers and lab values. He was a father, perhaps a husband, a provider whose presence shaped the fragile universe of a family. Every breath sustained by machines carried within it not just his own survival, but the survival of those who depended on him. Gorchakov stood at the bedside, his gloved hand resting lightly on the edge of the sheets, and felt the enormity of what remained at stake. The reputation that had lifted him above his peers, the countless moments when he had snatched lives back from death, seemed meaningless here. Before him was not a case, not a procedure, but a world balanced on the thinnest of threads, and he reviewed every intervention, every decision, every calculation with the merciless clarity of hindsight. But each path led back to the same wall. The damage within the man's body was not only physical, it was a labyrinth of complications that refused to yield. Each attempt at repair revealed new fractures, as if the man's very being resisted the possibility of restoration. In that moment, Gorchakov felt the sharp dissonance between the image the world held of him and the reality he now faced. He was known as the surgeon who defied death, a man who crafted miracles with steady hands, yet here he stood, paralyzed by the truth that his skill had reached its end. The man before him was not only unknown, but unknowable, carrying secrets in his silence, leaving behind only the haunting smile of a child in a faded photograph. The night unfolded into an endless trial, stretching time into something unrecognizable. Every fall in blood pressure, every alarm that pierced the sterile air, forced Gorchakov and his team back into motion. His hands, once steady with the calm precision of decades of mastery, trembled in ways he had never allowed before. It was not fatigue alone, but the weight of knowing that each intervention pulled the man not only from the brink of death, but from the fragile threads of memory and future that clung to him unseen. The operating room became a battlefield where victory was measured in seconds. The heart would surge with a flicker of life only to collapse again, leaving a hollow silence broken by the mechanical rhythms of the machines. The nurses and anesthesiologists exchanged weary glances, their movements automatic, driven by the authority of a man they had always believed invincible. Yet even they sensed the futility growing in the room, an unspoken truth that hovered like a shadow over every attempt. Gorchakov felt it pressing on him from all sides, the clash between reason and duty. His medical mind whispered with cold logic that prolonging the struggle served no purpose, that the body before him was no longer capable of sustaining itself. Every textbook, every lesson, every rule of clinical judgment pointed to the inevitability of surrender. Yet his heart, bound by the oath he had lived by, refused silence. The identity he had built over a lifetime was one of resistance against death. And to stop now felt like betrayal, not only of the man on the table, but of himself. The decision loomed as more than a medical judgment. It was a confrontation with his very existence. He saw in his mind the photograph of the little girl found in the man's pocket, her smile etched into him like a command he could not disobey. Was he fighting for the patient or for that child who would awaken to absence? Or was he fighting simply to preserve the illusion that even he had no limits? The monitor spiked and plummeted in mocking rhythm, each rise a cruel reminder that hope had not fully vanished, each fall a deeper descent into despair. The man's body had become a vessel for Gorchakov's own conflict, a battlefield where skill and inevitability tore at each other without resolution. He stood over the patient, shoulders heavy, eyes fixed on the fragile dance of numbers across the screens. The choice was no longer technical, but profoundly human: to continue and prolong the agony of a fading life, or to let go and accept the silence that had been circling them for hours. Logic urged him toward the latter, but the pulse of his own heart, the stubborn essence of the physician within, screamed against surrender. The night gave no answer, only the relentless echo of machines, and the weight of his indecision, pressing him toward a truth he did not want to face. By dawn, the man had slipped away. His final heartbeats were faint and uneven, like distant echoes of a bell tolling in the fog. The resuscitation attempts had yielded nothing but exhaustion, and the room sank into a silence that weighed heavier than any sound. Only the hum of the machines and the soft clatter of metal instruments remained, reminders of a struggle that had ended in defeat. Gorchakov peeled off his gloves with slow, mechanical movements, each gesture burdened with futility. For the first time in decades of practice, he felt an emptiness that resembled a bottomless void. The certainty that had carried him through countless nights faltered, replaced by a hollow ache that no skill or discipline could soothe. His body obeyed the motions of duty, but his mind wandered into the abyss of failure. At his desk, he wrote the report with a hand that moved steadily, yet without conviction. The words appeared clinical and precise. cardiac arrest due to multiple injuries. Yet each phrase felt like a betrayal. Behind the sterile terminology lay a catastrophe he could not translate into language. The truth was not a sequence of symptoms and outcomes, it was the extinguishing of a life, the collapse of a story that had stretched far beyond the operating room. The photograph of the little girl found in the man's pocket lingered in his vision, more vivid than the ink on the page. Her smile carried an innocence that deepened the wound he could not name. He understood with brutal clarity that this death was not confined to the body he had failed to save. It rippled outward into a child's future, tearing away the presence of a father who would never return. That realization struck harder than any professional shortcoming, piercing him with a grief that no medical logic could dull. When the paperwork was complete and the body was taken away, the silence did not lift. It followed him, clinging like a shadow. His colleagues offered glances of sympathy, but none could step into the space of his solitude. He bore it alone, knowing that the weight pressing on him was not only the loss of a patient, but the collapse of a promise he had always believed unbreakable. In the months that followed, his name continued to echo through conferences, journals, and textbooks. He was still revered, still cited as an authority whose skill bordered on legend. Yet for him, that name had changed forever. It had become a reminder of the night when mastery met its limits, when even the greatest hand could not turn back the tide of mortality. And beneath every accolade, he carried the memory of a photograph, of a child's unseen grief, and of the truth he had finally been forced to face, that no matter how brilliant, no physician could escape the weight of defeat.